Good morning, everybody. My name is Dr. Kenneth Fox. I am Chief Health Officer of the Chicago Public Schools. I want to thank you all for tuning in to our virtual parent roundtable. We're joined this morning by several special Chicago medical professionals who happen also to be current or former CPS parents or have other significant CPS family ties. They have kindly agreed to take part in this discussion about reopening schools to in-person learning with a focus on keeping students safe. Our conversation will be moderated by Commissioner Allison Arwady of the Chicago Department of Public Health. Dr. Arwady is heroically leading Chicago's COVID-19 response and is easily one of the busiest people in Chicago these days. So I want to thank her for making the time to talk with our panel and to help all parents tuning in to learn more about how the district has prepared for a safe return to school. We have certainly received lots of questions from our families and staff about reopening, and we hope we can answer some of those questions this morning. From my own experience engaging families and schools since the start of the pandemic, there's a lot of information coming at parents all at once. That's hard. And I know many in our school communities have a lot of questions about the health and safety of their children and the teachers they love. That's why I'm so grateful we are able to host this esteemed panel of medical experts to join us to discuss how we can safely reopen schools and to talk through all of the most important studies and scientific data that have been published over the past several months. That said, I'd like to give each of our doctors an opportunity to introduce themselves, and then Dr. Arwady will begin our roundtable discussion. One participant, Dr. Tommy Latimer, will be arriving a few minutes late due to a prior commitment. So we'll make sure that she introduces herself when she answers her first question. So at this point, I'm going to kick it over to our esteemed panel, and we'll have them introduce themselves. Let me turn it over to Dr. J, Dr. Johnson.
Thank you, Dr. Fox. Good morning, everybody. My name is Dr. Daniel Johnson. I'm a pediatric infectious disease specialist at the University of Chicago and Comer Children's Hospital. And I am the father of two former CPS students. They're now 30 and 32, so it was a bit of time ago, but nonetheless, that's my connection, an enduring one, to the Chicago Public Schools system. And I'll turn things over to Dr. Vollerman to introduce herself.
Great, thank you, Dr. Johnson, and thank you for the opportunity to be here. I am Dr. Anna Vollerman. I am an internist and pediatrician at the University of Chicago. That means I take care of children, I take care of their parents and of grandparents. I take care of school teachers and staff, including some from the Chicago Public Schools, and I take care of families. I'm a parent. I have a third grader in one of the Chicago Public Schools, and I also have two younger children, one of whom is a 4-year-old who's been back at preschool since the end of June. I'm excited to be here to share some of the science and to address the concerns and the fears that I've been hearing from my patients and from others. I'm going to turn it over to Dr. Wheat.
Good morning. My name is Dr. Santina Wheat. I am a family physician and I work for Erie Family Health Centers. And I also teach family medicine residents as part of a Northwestern family medicine program. I have two young children who are enrolled in CPS schools and are eagerly hoping to get the opportunity to see their friends again. And I care for people in all stages of their lives as a family physician. I deliver babies, I take care of patients who are living with HIV, I take care of entire families in one setting. And I'm going to turn it over to Dr. Woolner.
Hi, everyone. I'm Dr. Kathy Woolner. I am also a family doctor, and I work at the University of Illinois at Chicago. I also teach residents, and since the beginning of this pandemic, I've been caring for both adults and children in both the hospital setting and at our COVID evaluation clinic. So I've seen a lot of the care that has been required for folks who have been affected by this virus. I have two children. I have a 5-year-old who is a CPS student in kindergarten, and I have a younger son who's 3 years old, who, similar to Dr. Vollerman, has been back in in-person preschool since the late summer. Thank you for the opportunity to be here.
All right, so I think we've gotten through our introductions. I believe folks know me. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. I actually am also trained as both an internist and a pediatrician, so take care of both adults and kids, and obviously have been really involved in answering a lot of questions and looking at a lot of this science, working closely with CPS really throughout this pandemic. So maybe just to kick us off, I've got a list of some questions that have come in, and we're really going to have a conversation among all of us. But maybe I'll start with you, Dr. Fox, just sort of an obvious question, which is CPS is recommending that teachers and staff and students go back in person, but we're having this conversation virtually. So why aren't we meeting in person too?
Right. Well, we are delighted to have this conversation, but we do it, it's easy, it's efficient, and it's convenient. You know, I'm working really hard, harder than probably any other job I've ever had, but I'm in my slippers at home on a winter morning. Okay, we do it this way because we can do it this way successfully. My internet works well. I've got a laptop that's good most of the time. And more than that, I have had the benefit of in-person education my whole life. I'm not struggling to learn to read or to do science or math. Okay, but that's not the case for everybody here in Chicago right now. And it is incredibly important that kids, all kids, have the freedom and the opportunity to learn in person, just like all other kids in the city and in private and parochial schools and across the nation and really across the world. Students are back in person, and we want our students back here too, but we do it in the safest way. That's what we're going to be talking about today.
All right, and just maybe jumping right into that there, which is a heart of a lot of the questions that we've gotten. You know, each of you, each of us as doctors answer a lot of questions for patients, for families, and I know you've all been getting questions, as I have, about your own friends and families at the same time. So I'd like everybody actually just share the most common question you've been asked by parents with regard to school or students during the pandemic, and then just what your answer has been. And feel free, go ahead and jump in, and we'll just go around until we get everybody done.
Sure, I'm happy to start off. Again, Dr. Daniel Johnson. You know, the most common question that I've gotten is it safe for kids to go back to school? Is it safe for the teachers? And I get that question almost on a daily basis. And the answer I give is that it's definitely safe enough. You know, there's always risk associated with just about anything we do. Stay in your home, there's risk. Go out the door, there's risk. So the question is it safe enough? And the answer is absolutely yes. As long as the school is following a mitigation plan that has all the necessary parts and pieces to ensure that people are taking the time and recognizing what they need to do in order to protect themselves and protect those that are around them. I would like to just come back to that first question for one moment, if I might. And that is, we could have had this meeting where we were all together. That would have been just fine to do because we would have mitigated. We would have taken the steps that were necessary to minimize the risk. But as Dr. Fox points out, why? When we can do it even more effectively through this manner. So it's all about balancing risk and trying to figure out is the benefit of the great value. So thanks.
Yeah, thanks. And maybe just to jump on that even a little bit more, we're hoping hundreds and hundreds or even thousands of people actually tune in and watch this. And, right now in the time of COVID in Chicago, we can't pull 1,000 people together into a room. And so we do want to make sure that there's accessibility. That would be just one point on there. Dr. Bullerman, maybe, why don't you let us know what's the question you've been answering the most and the answer you've given?
Yeah, I think it comes back to this safety piece. People ask me, how can I stay safe? And it's about how can I stay safe about, reopening schools. It's also how do I stay safe in the other things that I do, and what are the types of things I can do? And really, it comes back to these simple and basic measures that we've been talking about and preaching, since the beginning. Wearing a face covering, washing and sanitizing your hands regularly, distancing, when possible, and then making sure that if you're sick or if that you stay home and that you're not, going around and potentially exposing others to whatever the illness is. And with those measures, those are really the best ways to keep ourselves protected and safe.
All right, great. Maybe Dr. Wheat?
Absolutely, thank you. So I think that the biggest question that I get asked in my practice is really about what I'm planning to do with my own family. Many of my patients know that I'm a mom. Many of them know that I say to them always, I would never recommend something for you that I wouldn't recommend for my own family, that I treat you all like my family. And so then we talk about that. We talk a little bit about the challenges that have happened with remote learning, despite teachers being absolutely fabulous in the work that they're doing, and the challenges that the children are continuing to have. And so then we talk about, well, how do you have your child wear a mask? How do you have your child follow the directions when we go in? And so I talk about how I talk to my children about these are the things that we need to do for you to do the things that you want to do. And then also the fact that I feel comfortable with my children going places following the mitigation strategies because I've been following them since the pandemic happened. This is what we have used in the hospital and in the clinic. A lot of the things that are laid out are exactly the same policies that I have been following and have been able to stay safe with. And so talking about how we can talk with our children and family members about following those same things.
Okay, great. And I'll turn to Dr. Wollner, and then we've had Dr. Latimer join us. So we're going around and introducing ourselves, but then also what is the question that you've been getting the most from patients and parents and related to schools, and what's the answer you give? So Dr. Wollner?
So same as what Dr. Wheat just presented, most of my parents or patients who I see also know that I'm a mom. And so that's the same question that I've been getting most often. What are your plans for your family? Are you going to send your daughter back? And I've had the benefit of the same experience as Dr. Wheat living through this pandemic in a healthcare setting. We have followed these strategies that we know work. We know that wearing masks and limiting the time you spend in close proximity to other people works to prevent transmission of this virus, and that building trust within a community so that people stay home if they're feeling sick or if they've been exposed, and kind of helping everyone understand why that's important and how it's in our interest as a community to continue to follow those precautions and be as cautious as we can to help keep our families, to keep our classmates, to keep our teachers safe. And my 5-year-old can explain why we do those things to me. She gets it. She understands, like, I have to wear my mask and we're going to see our grandparents outside because we don't want them to get sick if we could have a sickness. I'll just also add that I've had the experience of watching my kids return to a preschool environment, which of course is younger kids even, who are interacting with each other, and they are playing with toys and playing on a playground. And it has just been remarkable to see how 3 to 5-year-olds can wear a mask all day and do a really great job with it. They have taken on a lot of changes that are a lot for kids, but they're resilient and they're rolling with it. And I've been really impressed to see how much even really young kids can do to help us all stay safe and keep their teachers safe. And I really think that following those strategies, we can safely go back to school in person.
Mhm. Okay, and Dr. Latimer, please just introduce yourself, connections to CPS, and then go ahead and jump right into the question.
Okay, so my name is Tamitra Latimer. I'm a pediatrician at Lurie Children's. My clinic name is Lurie Children's Pediatrics at Deming. My husband is a high school Spanish teacher at Diet in Hyde Park. And the question that I've been receiving most from my families is, should I send my child back to school? That's the biggest question. And I ask them to really be, I do talk about the mitigation safety measures that CPS is doing. It's similar, I think other panelists have said that it's similar to what we're doing in the hospital now to keep patients and families and staff safe. And then I also say, how are your children? I turn the question a little bit and say, well, how are your children doing not going to school? How are you doing that they're not in school, that is virtual? And many are just, they just unload and they say how difficult it is and the connectivity issues and how sad their children are. And my husband sees it too, that since they're not in school, there's been a high no-show rate, or children or adolescents might check in, but they're not engaged. They miss that social connectedness. And so I say, let's weigh how has their academic education been virtual and their social well-being. And there's always pros and cons. Perhaps it would be better to have them be in person. Again, CPS is taking things really seriously with the mitigation protocols. That's a question that you have to weigh for yourself. But if you do pros and cons, I think the pros of attending school outweigh the cons.
Okay, thanks. And maybe let's dive in a little bit more actually on some of those mitigation protocols, because a number of you mentioned, it's similar to things we do in the hospital. It's similar to things we do at the health department. And also that it is hard, I think, for parents to sort of imagine this, very young children being able to do this. But, a lot of us have been out and maybe able to see that, including, I've had the opportunity to be in some of the private and parochial schools that have been, that have been open, or if you've got kids in the preschools, et cetera. So I know, each of you has looked a lot so that you're able to answer these questions about CPS's plans, the mitigation that's in place. And I'm curious from your standpoint, when you look at those, what are some of what you're looking for, and what are some of your answering questions for parents about what is needed for schools to be able to reopen safely and to stay open? And then do you think when you look at those CPS plans, what gives you confidence? What have you wanted to see more information about? What are you hearing from parents about? Let's talk some more about those mitigation plans themselves, because I know I get a lot of questions. So maybe instead of going in order, if someone just wants to jump in, and we'll take it from there.
If I can, starting with the very first thing before anybody walks into the building is that screener. I think that in general, as a culture, we have always sort of encouraged people to come in, even if they have a little bit of a sniffle, even if they have something. But this screener is really different than anything that we've ever done before, and really encourages families to keep their children home if their child is not 100% well, and for the teachers to stay home if they are not 100% well. And so we're really talking about people being in a space where everyone is healthy and not being penalized for not being there. Because if that screener turns red and you can't show up, then you can still engage at home. And so there's not necessarily any incentive to make sure that you're doing whatever you can to get that screener positive. It's really encouraging families to come when you're healthy and stay home when you're not. And that hasn't always been the case when you've had to weigh that, oh, my child just has a little bit of a runny nose, are they going to miss a whole day of activity? And that's really not the case with this opportunity.
Okay, great.
I'll chime in too to say the pods, so that students, educators, are grouped into one pod, and so they stay together. They come in and they immediately go into their classroom. They sit in the same chair or desk, and to maintain physical distancing. They do their lunch there. That's what I've read on the, so I think that is a really nice way to keep everything together. And also if there are cases that you can do in a better position to do contact tracing, that will prevent outbreaks.
Yeah, I'm looking for the same things that each of the speakers have mentioned so far. And of course, masking, about ensuring that there are ways to distance, hygiene, those kinds of things. But one of the big things I'm looking for is that sense of shared responsibility, that we really are our brother's keeper or sister's keeper. And that what we're trying to do is make sure that everybody knows what's expected. There's signage, there is shared information. And I went on the website. I was very impressed with how they talk about that it really is not just the individual, but this is a group activity that has to be done in order to protect each other. So I found that to be a very impressive part of this effort.
I think that's a really great point, Dr. J. And I mean, we share that I've been a pediatrician for over 3 decades. And so it's an incredibly important moment in so many ways. And one of those ways is this is a moment where kids can learn a lesson about altruism. I protect you and you protect me by, engaging these strategies, in a serious way, in a consistent way. And that's one really, I think that's one really important point that should not be missed. And also, just the delight in seeing how kids adapt to this. It never gets old. It never gets old to see how kids find a way to play. If that means I need to wear this little mask, that's what I'm doing. That's what they do. We've seen it. There's a question about, whether kids will do it or not. They'll do it. They've been doing it and they're going to continue to do it.
I'll echo that. When I had my then 3-year-old go back to school in June, and then Chicago put in place the requirement for anyone over the age of 2 to wear masks. And I had encouraged my kids to wear masks, but I was for a moment like, I love my 3-year-old. He has moments where he doesn't listen to everything I tell him to do. I will be frank with you. And I was, we talked about the need to wear the mask at school, but I was a little skeptical. And, after Labor Day, like, here you go, here are your 5 masks, or, good luck. And literally at the end of the first day, I was, when I picked him up at the front door, I was like, how did it go? And they're like, it was great. All the kids did great. They see each other doing it. They understand. We can tell them simply, we wear a mask to protect each other. And, now my son just puts on the mask without even me asking. It's just such a natural piece of what they do now. And, hopefully it's not forever, but it's not going to end tomorrow or next week or next month. And so this is the reality that our kids, will face for some time. And it is something that they adapt to and are resilient with and work with. The other point I want to make just about reviewing the reopening plan, I would echo what everyone else said. I think what hasn't been said is just taking a look at what happens when there is a case, when there is someone who's positive in the school. Because I think that is a concern of, what happens if somebody's positive or if somebody doesn't feel good. And I'll tell you, taking a look at the protocol, it looks very similar to the protocol my hospital follows. It looks very similar to the protocol my son's preschool follows. It's based in the science, and I think it represents what is the safest way to manage the situation.
Great. I think maybe does anybody else want to chime in on that, or otherwise maybe let's continue down that path a minute. We can come back around because, I think that's right. Like often it's not that we're not expecting to, it's not that we're never going to see a case in these settings. The question is the school setting itself a source of spread, a source of outbreaks, a source of risk? So maybe let's talk a little bit more about some of that difference, because I know that that's something certainly that, parents and very regularly we'll have questions about. So since schools reopened, whether over the summer when we were talking about daycares and some of the camp settings, we've again in the non-public schools, we've had schools open throughout the fall in some of our private and parochial settings. And then since CPS opened for the very youngest students in the cluster special needs students in January, we have absolutely had positive cases reported. So can we talk a little bit about the difference between cases and outbreaks, and then what your understanding is, from looking at these strategies, a little more drill into that. What does happen when there's a case? And then I can fill in on the health department side, where there might be outstanding questions. So feel free to jump on in.
Part of that question that I want to answer relates to what do we know at this point? Mm-hmm. And, a few months ago, we might have struggled with saying, well, we think it's safe, but we don't have enough data yet, that kind of thing. But now we have data from not just all over the world, but even in our own backyard, as Dr. Awadi has published on the parochial schools in Chicago. But we also have data on public schools from around the country, North Carolina, Michigan, Washington State. We have data from Mississippi. And maybe the most interesting thing about that data is that schools are protective. Actually, going to school reduces the risk of a child getting COVID. And that's because schools are controlled environments. When you're trying to figure out what to do with your child, because you're trying to work, you're trying to make sure they get the education they need, it means that you're probably taking some risks in environments that aren't as controlled. You don't know as much about some environments as you do others. And it turns out that school environments where there's mitigation going on, where people are expected to wear masks, where there's distancing, actually lowers the risk of children getting COVID-19. And the other thing that's been shown is that they're not taking COVID home. When you do comparisons of areas where schools are in hybrid mode or open and compare it to schools where it's fully remote, they have the same occurrence of COVID-19. So having schools open isn't adding to the risk. And in fact, for kids, it's lowering their risk. So adults, it's about equal. For kids, it's actually safer.
Thanks. I want to touch
That's a huge point. That's a huge point. Please go ahead, Anna. Let me not.
I just want to touch on to kind of this point about like having positive cases in the school, and kind of a misconception that that I hear often is like the fact that there's a case in the school, that's a sign that the systems have failed. And in fact, that's not true. There will be cases in school. There have been cases in CPS. There will have been cases in other schools. I can tell you there have been cases in our medical system, in our hospital, and I'm 100% confident there have been cases in every other health system. And those people were at work the day before or at work for a few days before that. Sometimes they were asymptomatic and their family member got tested and then they found out, So there have been cases and there will be cases. That is not a sign that our systems failed, that what the plan failed. The goal of the plan is to prevent spread from one person to another. And it's not just any one layer that prevents spread. It's multiple layers, because no one layer of the different things that we're doing is perfect. And so I just want to make sure that that point is really clear. There will be cases. What we're trying to prevent is outbreaks, is multiple people becoming sick and transmitting it to each other. And so that's, you know, if there's cases in different pods and things like that, that's what we need to be thinking about and worried about and trying to prevent.
Yeah, and I'll just to chime in on that quickly, because I think it is an important point. You know, the most common reason when we've seen more than one case in a school setting is because there are two siblings that attend that school, or there's a parent, you know, who is also a teacher and a student, for example. Right, it's not, you know, in some ways detecting the cases means your system is working well and that you have the mitigation things in place. There's contact tracing that happens within the school setting, and then the Chicago Department of Public Health does additional contact tracing for any contacts outside of school. So Dr. Wollner?
My light just went out, so sorry. I just needed to move. I'm at the hospital, sorry. I just wanted to add that I wanted to clarify what an exposure to COVID is, because I think that there's a common misunderstanding of, you know, my child was in a classroom with someone else who tested positive, they were exposed. Well, no, because we use strategies to prevent that spread. And that's exactly what Dr. Vollerman was just explaining. So, you know, when we think about in our healthcare system among our staff and our doctors, what is an exposure to COVID? It's if you were in an indoor space without a mask on for 10 to 15 minutes with that person. And so that's, if we follow all of the reopening plans that include mitigation strategies, that should really never occur. And the time where it's going to be most important to be thoughtful about that is going to be mealtime, mostly for teachers and staff. And so we've been really thoughtful in our work environment about having people eat as spaced apart as possible and to not be speaking while they're eating, so that they're just keeping all of their secretions and their whatever to themselves if they were to have an asymptomatic infection. But those precautions really work. Those precautions really work.
I also wanted to say, to highlight the piece about the siblings, that most often when there is more than one case, that it happens to be siblings. I have to say that I am so thankful for the plan that CPS had of, I have 2 children, and so making sure that they're going in on the same day. And so that if there's an exposure, knowing that if I'm going to have to keep my kids home, they will both be home. And that if we know that one child in a classroom is positive, then their sibling will likely be asked to stay home too. Just knowing that we're thinking about that and thinking about families, and how do we limit those exposures. And I think that many of the strategies that were put into place have really been thoughtful about how can we limit those times where people are in close settings. So even I went to our hybrid meeting the other day, and even thinking about using doors in ways that have never been used before, and going into all of the different doors of the building. And that's just never happened at the school before. And thinking about how they're really keeping children out of being in close proximity within the hallways. And so all of those times where we would typically think of our children and our teachers being really in close proximity, that those have been thought through and taken away, so that we really are maintaining that distance and preventing these exposures.
Mm-hmm. All right. Please
Just
go
to
ahead.
just to give a sense as to how well mitigation steps work. In the North Carolina experience, where they were looking at multiple school districts over an extended period of time, they would have expected 800 to 900 cases of COVID in the schools if they weren't mitigating. But what they had was under 50, a huge reduction, and just shows how well those steps work. And in fact, many of those cases were cases that, as others have talked about, were related to a family or siblings, so that the actual amount of transmission within the school setting was even lower.
Dr. Latimer, I think you had brought up initially when there is a case, a little bit sort of what happens in that setting. Can you maybe talk us through in a little bit more detail, sort of play that out, how you understand that that working?
Sure. So let's say that it's an educator, a teacher that tests positive. They will, when I looked at the website, they said a runner will go and get the teacher, pull the teacher out of the classroom, get all their belongings. And then there's a confirmatory test, PCR, which takes about 1 to 2 days. And the teacher is waiting at home. And depending on the results, if it's positive, then that teacher needs to remain at home for 14 days, sometimes 10, that's what the information is saying. And then that's when the contact tracing is done. So notifying those family, or notifying the individuals in the school, but again, not identifying who that person is, because we really need to maintain privacy. But as we have said, that if these mitigations are in place, then it's really not considered an exposure. So if we're really maintaining, likewise for the student remains in the pod, minimizes contact until a parent can pick them up, and then they remain in quarantine until they have their confirmatory PCR test.
Yeah,
and so they remain in. Go ahead.
No, go ahead. I didn't mean to interrupt.
I was just going to say they remain in quarantine for 14 days. I must say that it is challenging if you're in a family. It's really hard if one parent or one child is positive to self-isolate from the home, especially if it's a smaller home. So it's a challenge. So you kind of expect that if there is some positivity that maybe everyone in the family might. So I think it's important that measures are in place to plan for the whole family quarantining.
Yeah. And I think, to that point, just we've worked hard, I think, and Dr. Fox, you can chime in on this, to really be the most conservative in this setting, where there are these pods with just, about 15 students. So these are not, the full packed classrooms that people may be imagining. And then that group is kept together really as much as possible. So you've got the teacher, you've got the students. One of the reasons why, starting with the younger children, the elementary, K through 8, not as much need to be transitioning between teachers and subjects and moving around. And it really lets you know that if there is a case, even though we know that we've got the masking, we've got the distancing, all these things are in place, there is a limited number of people who may have been exposed. We then are careful to do that quarantine, follow up with testing as necessary, et cetera. And again, the great majority of the time, we don't see additional spread, but we're careful to sort of take that most conservative approach, just to make everybody, staff, students, teachers, feel as comfortable as possible. So thanks for that.
That's exactly right. I just wanted to add that that we're prepared for situations where there's a case in a pod, and everything begins with a self-report. This is incredibly important for parents, for the families to understand. When there's a positive test, we need to know about it, and we want the parents to notify the district. And the way to do that is, the best way to do it, the most efficient way to do it, is online. It's at cps.edu/COVID results. And where that gets you is in contact with the contact tracing team. That's a team in my office, especially trained to investigate these cases, to do the intake here. And we do this, we develop this plan in consultation with CDPH, of course. But what happens is the contact tracer reviews the information. We call the family. We got to get the details about the case. We want to hear directly from the family, the details about what's gone on. And the interview takes, 15, maybe 20 minutes. We're also gathering other kinds of data so that we know who was where, who was that child with. When we have people organized in pods, then that makes it easy. So we say that everybody in the pod is a direct contact. And once we gather the information, we get the details, we analyze the case, and then we provide guidance to the school, and we notify everybody in the school about what's gone on and what they need to do to be safe. Essentially, we do this so that we know who the direct contacts are, who the direct contacts are, and who the people are who are perhaps present in the school but are not direct contacts. And we basically have built up some very strong muscle in this regard over the past number of months. Contact tracing has been going on at CPS since last March. So we know how to do this. We have a team ready to do it. But it's really important that everybody know that this process begins with a self-report. That's whether it's a student or a teacher.
Yeah, and I would just add to that in the case of CPS, again, there actually has been some work to go beyond what is required and recommended to also have some testing in place for staff so that there is routine at school testing, not when people have symptoms, because if they have symptoms, we don't want them in the school at all, but actually doing some ongoing testing there. And that's what you heard. If some of that were to be positive, we do a more confirmatory test. Again, another piece, because we really want to help people, all people in the school setting, really feel as secure as they can. Let's turn to vaccine, if you don't mind. I know all of you take care of kids, so we all spend a lot of time talking about vaccines. And we've gotten some questions, and there certainly are some people who believe that schools should not reopen until every single teacher, every single school-based staff member has been fully vaccinated. And I'm just interested in your thoughts on that.
I'll go first. I think that would be a challenge because, first of all, the Pfizer, let's just take the Pfizer vaccine, is not available. It's only for use in adolescents 16 and over. And so that would kind of discount or cross out a lot of our younger children. Also, there are steps in place to vaccinate teachers and staff, but that's a slow going. And I think that there's mitigations in place. We've already done a great job saying that the data, the science shows that when mitigation protocols are in place, it can be safe. And to wait until everyone is vaccinated, that might put us into next year. And I do believe that getting children in class is vital and paramount, and we can do it in a safe way. And as parents, we can model that behavior when we go out wearing masks and showing our children how the safety measures really can keep everyone safe. So I'm not a proponent to wait. I just think we would be waiting too long.
I would add to that. I think that the vaccine is a wonderful thing. I'm so glad that we have it. It is not a cure-all. It is not the only tool in our toolbox. We really need to think of the vaccine as just one piece of this entire conversation. Also, I think that we also need to look at the of choosing to be vaccinated, and that not everybody is choosing to be vaccinated even when they are eligible for it. And so I think that it's important to know that there are some people that will always choose to not be vaccinated, or some people that are unable to be vaccinated because of their own health reasons. And so it's important to know that of course we want everybody to be vaccinated as soon as they can. I spend a lot of time talking to my patients about why I think they should get it and encouraging them to when it is their time. But we know that not everyone will. And so to me, that is not the thing that we should be waiting for when we know all of these other steps work as well.
I agree with what's been said. And I'll just add that what I hear kind of underlying that question is just concern about teacher and staff safety, which I totally appreciate. And I think is really important, because me as a parent, but also as a doctor and someone who cares about my community's health, I wouldn't be saying that I think it's safe to go back to school if I thought that it was putting teachers or staff in harm's way. I think that I really appreciate the evidence that we have that Dr. Johnson presented. And I love that we have that we have those studies from other communities who have gone back to school. And I also will just say, from more of an anecdotal place, I have cared for so many families who have been affected by COVID, And I, have done testing for parents and grandparents and children and cousins, and I've heard so many different stories about how COVID has come to that family. But I can't remember one scenario where a child was the first person to be infected, that was the first person who had COVID. It has almost always been that there is an adult in the family that through some exposure has contracted the virus first, and then it's been passed along to the family in the home. And so there's been discussion since the beginning of this pandemic that we think logically from other experiences with viruses that kids are likely to be less likely to spread that virus. Of course, it's not that it's zero, and that's why all of the other mitigation strategies are so important. But I really do think that this plan is also safe for teachers and staff, and I so appreciate everything that they do for our kids. And I wouldn't say that if I didn't think it really were safe.
Since Dr. Arwady brought up the vaccine, I also think we should mention how important it is that everybody get the vaccine. Anybody who can should, and when your opportunity comes up, please go ahead and do it. I've gotten both of my doses, and I can tell you, other than a sore arm for a couple of days, and with the second dose feeling a little tired for a couple of hours the next day after receiving it, certainly had no problem. And I can tell you, I got vaccinated for myself, but I also got vaccinated for my family. And that's because it lowered their stress level. It meant that they weren't as worried about me, quite simply. They felt like I was one step safer in terms of not getting sick from COVID. And that lowered their stress level. So if you can't get vaccinated for yourself, get vaccinated for your family, your friends, your coworkers. That way, everybody else doesn't have to worry about you.
And maybe I'll chime in just a little bit there. I think it's important that parents are all hearing that there are not COVID vaccines available for children at this point. The studies are still going on. We've got to check the safety. We've got to check how protective they are. We've got to make sure the dosing's right. And so we don't expect there to be vaccine available, period, for children, probably until the summer at the very earliest. And for younger children, it may even be beyond that. And I think the other just piece to put in here is that, we would love to be able to vaccinate everybody right this minute, right? And the biggest challenge is just that this country is working to ramp up vaccine production. And so here in Chicago, we receive less than 5,000 doses per day to go across the whole city of Chicago for first doses. And that has to spread across, the healthcare workers like all of you who are being exposed to COVID every day, which is where we started, but it's got to go across our oldest Chicagoans and our people who live in the most vulnerable settings. We've been vaccinating in homeless shelters and long-term care facilities and nursing homes and, places where people really need a lot of hands-on care. And there are a lot of essential workers and settings where we've seen a lot of outbreaks. So whether those are manufacturing settings or in our first responders and others, it is really important that we spread this vaccine across the city in a way that gets it into the spots that most gets our city past COVID. Teachers and staff are absolutely part of that plan, but there are more than 140,000 educators in the city of Chicago. And so where I think about, if we were to take all of the vaccine, the first dose we were getting, for 5 weeks, we could get through educators, but that would mean not vaccinating anybody else, many people at higher risk. So there are plans in place, just I think it's important to be said already. There's plans to make sure teachers are eligible right now, but there's so much competition that there also will be vaccine directed through CPS, just as there is through all of the other schools, to ensure that there is a stream of vaccine dedicated for teachers and for other staff. But it is just going to take time. And, if we could get this done in 2 weeks, we wouldn't be having this conversation. But just with the way that the supply is coming, the vaccine is one additional piece, and it is not the most important piece that helps really keep schools safe. Dr. Villerman.
I just want to add one thing. I think what I've been hearing from a lot of families, from teachers and staff, from parents is, I'm willing to go back to school after I get the vaccine or after my child gets the vaccine. And along with everything else that said, I want to be clear that the vaccine doesn't change things.
Right.
So the vaccine doesn't change the fact that kids will stay in pods and kids need to wear masks, and that there will be some people that continue to remote learn and some simultaneous instruction, and that we need to physically distance. It doesn't change what the school looks like in any way, shape, or form at this point. We are in this for many more months, if not into the next year. And so, I don't think the vaccine is a light switch that we're flipping, that once you flip it, schools go back to normal. And I want people to understand that and to be clear about that.
I wanted to address the vaccines because I care for a lot of patients that are medically underserved. Majority of my patients receive public assistance, and many of my patients are Black and Latino, and many those that have expressed their concerns are really very wary about getting the vaccine. And I think that this is, not news to any of us on this panel, that there's some wariness given the previous very negative history of healthcare and public health toward people of color. And I think I use my platform to say, hey, I've gotten my vaccine. And I do have a good relationship, as we all have, with many of my patients. And I think that's an important thing to note, is not everyone is ready to get the vaccine. I have colleagues that are not ready to get the vaccine for various reasons. And yes, it would be ideal for if the vaccine was available, and if if everyone got it, if it's available. But I think we need to be mindful and keep on pushing that message, positive message, that this is a way, like Dr. Johnson said, to keep yourself and others safe, but also being mindful that not everyone is ready to take it.
Mm-hmm. Yeah, thanks for that. So we're coming up on time. Maybe we'll just do a quick kind of lightning round on what do you think, what's the most important piece of information that you'd like families to take away from this conversation? Whether it's a misperception that you think needs correcting, whether it's something you really want to drive home, just sort of one kind of quick takeaway, minute or so, and we'll just go around and hear them.
I'm happy to start. I think for me, the key thing I want people to take away is that the strategies that we have to prevent and the spread of COVID and is dependent on the actions of individuals, on the actions of children, of parents, of teachers and staff, on families, and so on. And so it's not something that somebody provides to you. It's decisions that we each make. The decision to wear a mask, to be honest when we fill out the symptom screen, to report, to wash our hands, to distance. And so these are things that we can each do to contribute to that health and safety in schools and in our communities. And if we do these things, we can get back to schools safely in person, and we can work towards getting our entire community back to some level of normalcy. That will take time, but we will all get there together.
All right, great. Who's next? Lightning round.
I can jump in and say, I just want to say that I really think that the strategies that CPS has laid forth have really been demonstrated to work. And not only that, the strategies that are laid forth by CPS are more stringent than even what I have at my hospital and at the clinic. And so we really are looking at things that are really in place to keep our teachers and children safe.
Great.
I will echo that schools are not a source of transmission, and that CPS has mitigation protocols in place. And if they're followed, then we can get our students back in school where they are in the best place to learn.
That we do have control over this and that we're all in this together. And if we follow the rules that have been laid out, we create a safe environment for each other.
I love all of these wrap-ups, and I'll just add that we're not ever going to be able to bring our risk of transmission down to zero, but we have so many strategies that can significantly reduce it. And when you really look at that risk benefit balance of what do we gain from getting kids back to school, there's so much that we gain. And I really think that that is where we can kind of focus our positivity and do all that we can to keep that risk as low as possible.
All right, great. Well, I personally just want to say thank you to all of the doctors, willing to take some time out of their busy clinic schedules. I always enjoy the opportunity to hear directly from people who are talking to parents about this, and appreciate, everybody. I hope people who were tuning in, got some of your questions answered. We tried to get through as much as we could here. And I'll turn it over to Dr. Fox to close out.
Oh, thank you, Dr. Arwoody. I just am so grateful for this panel. I'm so grateful for the work that you do and the way you have really shown up to help keep everybody safe. This was a really rich and frank discussion with a very special group of people, wise and caring people. And we are all in this together. Thank you, Dr. Arwoody, for moderating, and to all of our parents for taking the time to listen, and to all of the panel for sharing their expertise. To everybody listening, we hope this has helped you learn more about not only what the district is doing to support students and families through the rest of the school year, but also how we concluded that students should have the opportunity, the freedom to learn in person if that is what works best for them and their families. The district and its families are partners in our mission to provide every Chicago student with a high quality education. And I want every parent listening to know that regardless of what you believe, your voice matters to us, that we're listening, that we hear you. We may not always move forward in the direction that you would select for your child, but know that we are engaging as many families as possible as we make these really important decisions. We'll continue to have these parent discussions to keep you informed about what you need to know about the rest of the school year. So until our next one, I want once again to thank all of you for tuning in, and I hope all a safe and a fun weekend. Thanks, everybody.